Hello, my name is Letitia Chambers, and I'm here to discuss my psychosocial intervention during my level 1 fieldwork. As the occupational practitioner, my role is to facilitate the client's engagement in meaningful occupations while addressing, for this intervention, their psychosocial aspects. This included providing therapeutic activities and to promote physical rehabilitation, cognitive engagement, and emotional support to ensure a holistic approach to recovery. So for this intervention, we were asked to select a psychosocial frame of reference, and for that, I chose MOHO. I chose MOHO, which is the model of human occupation, because it emphasizes the importance of understanding how the client's habits, roles, and volition, which is their motivation, and performance capacity interacts to influence their occupational engagement. It allows for a comprehensive understanding of how my client, who is a pilot, injury affected his identity and motivation to return to work and his engagement in meaningful activities. As far as the intervention, we performed some fine motor skills and strengthening for his affected hand. What we did was we took some putty and we wrapped it around a built up handle, but we made it really bulky, and he would have to squeeze and squeeze, and that in turn would help with to improve his strength and dexterity in the injured hand. For therapeutic activity, we also chose to, I had him provide or create a pre flight checklist and a flight plan. And he had to make this list with he opted to do it with his affected hand. He was able to write out the list, and this helped him to show how at work he has to organize materials and performing tasks for, pre-flight preparations. And this has helped to assess like his readiness, and it taps into his cognition, and it helped to build his confidence in returning to work. Um, we also implemented some stress management techniques where we did some guided imagery where he had to close his eyes and imagine being in the cockpit, imagining where everything, all the buttons and controls are, and what he is needed to do. Um, and that in turn helped him to kind of reduce a little bit of the anxiety and the fear. We also did some breathing exercises to help manage, any kind of anxiety or stress, and help calm his mindset about, regarding um, his psychosocial issues, which were the fear of returning to work, and there was some in the beginning, some mild financial anxiety. So my rationale for using these activities is because they're meaningful to him, and they also will help him to regain his physical abilities, which are necessary for him to fly. Um, while addressing the psychosocial aspects of fear and financial stress. So by gradually integrating him into like the pre-flight routines, we promote confidence in his abilities. Stress management is hopefully going down. He said he enjoyed the activity, so it helps it also allow techniques to help him develop coping mechanisms if he needs those. He could use them in the future. Um, as far as implementing MOHO, the use of this frame of reference was to emphasize how, the pilot, being a pilot, that's his identity. And it helps him with his motivation and how that impacted his life when he came to a complete stop and he couldn't fly anymore. So understanding what his motivations are, his roles, and helping him to adapt to his physical limitations, because he probably would never be able to make a full fist again, but he can use what he has to be successful and functional in his career. So this helps him to regain his identity and addressing the underlying psychosocial components that affected his performance. As far as potential variations based on psychosocial factors. In this case, my client, he had minimal psychosocial issues, I would say that. And I think in this case is very rare. He was highly motivated from the beginning. He, those thoughts did creep into his mind, but he did not let that stop him from, um, participating in rehab. He never missed a day. And I think that aided in his recovery very well, because being motivated and getting past that is a big hurdle for most patients. Most patients can't get through the pain. They can't. They're not motivated. Their life some patients' lives have completely changed due to their injury. So with this patient, he was highly motivated. He had a positive mindset, and that in turn really helped to push him forward in his recovery process. For as far as future improvements, if given the opportunity to provide this intervention again, I would, if I had the opportunity or the means, I would include some technology-based um, aids, such as like a virtual reality that was more immersive and create like maybe a simulated flight. A flight simulator, and I think that could very much so be more, very helpful in mimicking the flight environment, enhancing the collaboration between you know, him understanding like um, how that is beneficial to him, and how that's going to help him and make him more confident in returning to work. So those are the things that I think my session was um, successful. He enjoyed it thoroughly. He's a very positive person, so it was kind of easy. I'm not gonna say it was too easy, but it was definitely helpful when you have someone who's on board and ready to participate, and that's what I love about this field. So that is the end of my discussion. Thank you.